So guys, this is my theater experience. Let's go. So guys, how are you guys? I just finished my shift and today I went to this shop here because I forgot my pillow at home, and last night I had a terrible night. So I have to buy a pillow. So I went there. Lucky they're open. The reject shop was open, so I ended up buying one because I forgot my pillow yesterday. And lucky it's open, so I went there in the reject shop. So I went there, guys. Lucky they're open. I was so glad I got my pillow for tonight. I hope I will have a good night's sleep tonight. So I'm actually assigned in a theater, guys, today. So I am in with the anesthetist nurse. So yeah, so I was so hungry. So shift starts at 7 o'clock and finish at 3:30. So I'm gonna go to Safeway and maybe buy a little bit of food, and then 2 days down, 8 days more to go. So yes. So guys, good morning. Day 3 today, and we are on a morning shift. So 7 to 3:30 is our shift today. So I'm just gonna go into the main entry and sign in and get screened. Day 4 today, guys, and it's very foggy and cold. 6:30 in the morning. So guys, I'm here at the accommodation at the moment, and I am just doing some homework because I finished at 3:30 today. So I started 7 o'clock this morning, and I'll tell you more, guys, about placement in perioperative. So I was assigned in an anesthetics assistant, or like anesthetic nurse. So my friend, she is assigned in PACU, like a recovery, and I was in anesthetic. So I was with the anesthetic nurse and then with supervision, of course, because we are only a student. But anyway, I will run through what we do usually in as an anesthetic nurse. So first thing is we have a list of the procedures that's gonna be on the day, like for example gastroscopy, colostomy, colonoscopy, some are total hip replacements. So you will get your list for the day, and then after you get your list, you will prepare all the equipments, make sure the anesthetic machine is ready, that it's fully working and functional, make sure your medications are fully stocked, and make sure that you have your monitor equipments on, blood pressure cuffs ready, IV fluids ready. And yeah, so usually the theater surgery starts, or the procedure starts at 8 o'clock. So as soon as the anesthetist come, we check in the patient, we receive the handover from the admission. So we receive them, we check their consent, if they have they've been fasting, they have allergies. So after we check them in, we will take them to the anesthetic bay, where we connect them to ECG monitor, put some BP cuffs on, put some IV fluids on, and then the anesthetic doctors will come and see them. And then once the theater is ready, we will take them down inside, and then the anesthetic, you will just have to assist the anesthetist to help with the airway. If they need ET tubes, or they need some like different types of airway, you have to help them, and then you just have to assess them with the process. And after that, you hook them to the monitor, to the autosats, and then just keep an eye on the observations if it's still in the right range. And then you can also see a lot of stuff there in the monitor as well. And then after that, when they are nearly ready and finished with the procedure, you will have to look on your list who is on the second person that's going on the list, and then you will call them. If they are from the ward, you will call them, and if they are from the admission unit, you will call them and bring them over, or they will bring them over, and then you will get them ready. So that's that's the flow of the patient admission going to the theater. And then after they are ready and the procedure is done, we will also assist the anesthetist with, like, for example, extubating or removing the ATT tube out or putting another airway in. And then after that, we unhook them to the monitor, and then we will wait for them to stabilize a little bit, and then the anesthetist doctor will take them to the recovery, and then that's how it is. So there's actually in perioperative nursing, there's actually scrub scout, where the ones who's doing scrub and handing the equipments or the instruments to the doctor. There is the scout that circulates and just do the counting, but I haven't really had that opportunity to do the scrub scout. I was just with the anesthetist nurse and then the one in the recovery. So that's all I can tell you guys, and so far I am loving it. We did a lot of gastroscopy and colonoscopy, and then CS as well, cesarean, knee replacement. Yes, those sorts of procedures that are very interesting to watch. So yeah, I'm enjoying it. And then we actually have 2 weeks of placement, and this is our 6th day. So this is Monday today, and we finished the first week last week, and today is Monday. And while I am doing my placement at the moment, I am doing some homework because we have 2 subjects going on at the moment, and we have 2 assessments, which is the research and the other one. So the other one has 2,000 words, and this one is a 2 assessment one, the research, and it's 2,000 words each as well. And this is due on the 18th of August, which I haven't started yet, so I better go and get started, guys. So I'm just doing my homework at the moment, guys. So this is actually not the placement subject that I'm doing at the moment. This is the 2 last subjects that we're doing for the year, and hopefully I still got 7 more weeks to go. And yeah, update, guys. So today is day 8. No, not day 8. Yeah, day 8 of placement, and I just come home. So today I was in theater 2, and we did some, actually I observed some knee replacement, right knee replacement, and shoulder manipulation and arthroscopy. So a bit haggard because you have to wait. I'm in joint replacement. You can't go out of the theater room until it's finished because it's prone of infection. And so yeah, actually a bit interesting seeing the knee replacement. So guys, it's very cold today and it's raining outside, so I'll show you guys. So I'm just actually doing my homework at the moment. So I finally started the first sentence. It's the hardest part of the homework, is to start. So I finally started 1 sentence. So our assessment actually, guys, is research, but we don't make a research, but we will critique a research paper. So that's what I'm doing at the moment. So today's Tuesday, so I got 3 more days. No, today's Wednesday. Today's Wednesday, so 2 more days and I'm going home. So I better start something before I go home. So I'll show you guys outside my window. Accommodation, and this is actually my accommodation, guys. It's like a dormitory, but it's really good because it's got a kitchen, it's got a lot of bathrooms and showers, and I have the double bed room. My friend was here last week, but she moved out to a different room, which is a single bedroom, because we have different shifts, so we can't be in the same room, or else I'm gonna waking her up. So I'll show you guys outside and I'll show you the inside room. It's a bit messy, but so this is outside our accommodation. It's pretty big, all the way up there. Garden. And there's a tank here, and this is, it's a bit rainy. There's a bird there. So I'll show you guys my accommodation. So that's the window there. It's massive window. It's got a chair there, and it's all my food went. It's a bit so messy, guys, so bear with me. That's the door. There's a cupboard right there. There's my bed, and this is another bed, and there's a cupboard, there's a light, and there's a desk there, there's a board, there's a light. So it's a big room. So I show you guys when I'm in the door. So much mess. So that is how it looks like when you're from the door. And the kitchen is just right there across the whole lot, just there. And there's bathrooms everywhere. So yeah, let's do finish this homework before the laziness kicks in. Last day today, guys. Day 10, and then we're going home after this. Let's go. So guys, finished today, last day, and it was fun. That was the best placement I've ever had in surgical, like theater or operative, perioperative. So yeah guys, that was 10 days, and I'm going home now. And thank you guys for watching. If you have a question, just leave a comment down below, and don't forget to subscribe. Bye guys, see ya.